Doctors are facing unacceptable delays because of repeated failings in the way that the NHS reads scans.
The Health Ombudsman says failings have continued despite the publication of a report with similar conclusions 4 years ago. Our health correspondent Sophie Hutchinson has the story.
Scans, along with X-rays, are one of the best ways to rule out cancers and other serious conditions. But there are concerns that some NHS patients in England have been harmed after getting the wrong results. A report by the Parliamentary and Health Service Ombudsman says critical errors are being made. 45 complaints have been upheld or partially upheld. They include failures by doctors to spot dangerous cancers, appointment delays caused by waiting lists and a lack of follow-ups. Radiologists, the doctors who analyse scans, have said there needs to be more learning, but they also underline problems in the wider system.
We're really short of staff. I mean, a 30% shortfall of consultant radiologists. So everybody's not only trying to get it right, but they're trying to do it quickly, because we're all conscious of the fact that patients are waiting, and that's also terrible for patients. So the workforce is under pressure.
The Ombudsman says it's critical that action is taken to improve the safety of scans. NHS England has said it delivered a record number of tests last year, but has acknowledged improvements are necessary. Sophie Hutchinson, BBC News.
Rebecca Hilsenrath is from the Health Service Ombudsman. She joins us now from North London, and also with us Professor Pat Price, who's a clinical oncologist. Good morning, nice to have you here. Rebecca, let me start with you. Let's just talk about the findings of this report, because as we said, there was a similar report in 2021. Why has very little, seemingly, changed?
Absolutely, and that's why we flagged these issues. For us, it's a patient safety issue, and it's also, I'm afraid, about a failure to learn on the part of the NHS. I completely get the point that's been made earlier about pressures and about the number of excellent NHS staff, who are struggling. But it's not just the fact that we issued a report on identical findings 4 years ago. It's the fact that we're the complaint handler of last resort. So every time we get a complaint, that means something's gone wrong, and it has not been resolved by the relevant NHS trust to the satisfaction of the complainant. So when we uphold a case, and there have been 45 since our report 4 years ago, those are failures to identify problems through scans, or delays in having scans, or delays in following up scans, which have not been identified as failures by the NHS trust.
That's the picture, Pat, from the watchdog's perspective, from you as a clinician who meets patients. I mean, some of the examples we've seen, a 10-month delay in cancer being diagnosed, significantly harming a person's chance of survival. Another patient had serious pelvic sepsis missed, leading to an avoidable death. Is there a world in which where you can just see that this happens, or is it because of pressure?
I think this is what we've been saying really since the start of COVID, haven't we? It got bad. This has been 5 years. The pressure on the NHS is huge, and I think there are waiting lists, that we haven't got enough capacity, we haven't got enough workforce, we haven't got enough technology. This is happening all over the time, and as we say, this is just the tip of the iceberg. But this is happening throughout the cancer pathway, not just diagnosis, but in treatment. It's about getting things right, and what are the structures that need to put in place to help the world-class staff that we've got do their job properly.
Because relatives of these victims, we can call them, will say, you might be under pressure, but this is sloppy work and it's cost the death of a relative.
I think it's not all sloppy work. Obviously, some people can make mistakes, but they're under pressure, there's not enough staff, and also they haven't got the tools they need to do their job. A lot of it's about communication. To interpret a scan, you need all the information about the patient. If you're not getting this, or as the Ombudsman found, sometimes the outpatient appointment isn't made. This type of thing. So it's all along the line, and unless the changes in the NHS that are going to come now and the cancer plan really address these fundamentals, we're going to continue.
And Rebecca, that's the point here, isn't it? It's a chain of events, because, people looking at this will say it's a battle just to get an appointment. Then it's a battle to maybe get the scan or the X-ray or whatever sort of diagnostic you need. And then it's another thing to have that read properly and diagnosed and work out what actually is wrong. And then it's another to get the treatment. I mean, at each stage of that, there is potential for this to fall apart, isn't there?
I think what we're seeing is, as you say, there are a range of challenges here. And one of the things that we recommended 4 years ago was looking at the digital infrastructure of the NHS, because what we've seen is failure to look at incompatibilities between different NHS trusts and between hospitals and primary care. And we know that that's a massive issue which we want to see addressed in the 10-year plan. But it's also about learning, because some of these instances and the cases that we flagged have been about, so there's a grandfather who went to hospital for a scan, and the scan just was not reviewed, did not pick up that he had bowel lesions, identified on his 5th visit to A&E, and I'm afraid took his life after that because he said he couldn't cope with the pain. And I think it's really important to understand that there are people who are dying who perhaps should not have been dying, and even those who were always going to face a difficult outcome because of an aggressive cancer have not had the time with their families that they deserve to have.
You talk about the recommendations you made in that 2021 report. What is the answer to this? What is the solution? And of course, it's more funding and more resource, but what else needs to change?
So it's not all about funding and resource, and we have been monitoring what the NHS have been doing in relation to the recommendations we made 4 years ago, and we have a meeting coming up with them shortly where we're going to be looking at what they're doing. And of course, we've flagged these cases today precisely because they echo those concerns. But we know that NHS England is being abolished, and for us, this time is an opportunity to look at culture and leadership. Is what's going to come behind that next? Is that going to be an NHS that welcomes learning, that has the right leadership to ensure that there's the best patient safety outcomes when things go wrong?
Pat, we'll put that to you then, the abolition of NHS England, but also the Department of Health and Social Care telling us, there is a plan to fix the health service, including in cancer care. They plan to see 100,000 more patients receiving a diagnosis within 4 weeks, up to 19,000 more people starting their treatment within 2 months each year. Do you feel optimistic that the tide is turning, that change is coming?
I think I can only reflect what she said so extremely well. I think this is the start of a change. I think there's the Darcy review. Yes, it's broken. We spent 5 years saying it wasn't broken. Yes, it's broken. Now we've got a change in NHS England, more accountability, more direct. But there is so much more to do in terms of fixing the problems. We need that change in culture. We need to listen to frontline staff, get experts in, find the problems that need fixing. We've been giving solutions out for the last 5 years, but there's nowhere to take them. Nothing happens. And so what we need is direct action so things actually happen. We need to have an affordable plan, and it isn't all about money. It's what are the people doing? Are people coming down and saying, how can I sort your problem out for you? Is it a fact that the IT is not compatible? Let's fix that. We could do a huge amount, but I think they have to be, the Department of Health have got a big job on now, and they're good people there. And we've got good people there, and you've got a world-class workforce. Let's get them together, and we can do this, but we've got to be bold, and they've got to not just keep doing the same thing.
Professor Pat Price, clinical oncologist, and Rebecca Hilsenrath, Ombudsman in the Parliamentary and Health Service. Thank you so much both for your time this morning.
It's 26 minutes past 8. If you're just waking up this morning, our main story is that Heathrow